Which one is pointing? Okay, good afternoon, ladies and gentlemen. Try to wake you up because it's almost the last presentation, and then after that, because this afternoon from 1 o'clock you have heard about the herpes virus, and especially for the clinical side and everything. And one of the treatments that is you have to use plasma transfusion. That is one of the highest recommendations that you should go on. So that is my talk today. I would like to talk about plasma transfusion, and also we have to prove for the efficacy of fresh frozen plasma. Because when we collect blood, and then after that we have to separate for the plasma, and then this plasma can be used for treatment of the herpes virus. Okay, this one I don't have to talk anything much about that, but you have seen this for this whole afternoon in both Asian and African elephant. But in Asia it is quite severe, so there will be some coagulation disorder and also severe blood loss of the elephant calves and die from hypovolemic shock. One of the treatments that we have to use the plasma transfusion. So when we want to treat the animals, so we can do blood collection from the adult elephant. From theory, that one elephant has around 8% of the blood of the whole body weight, and then after that, if we want to collect the blood from that particular elephant, we collect from around 20% of the whole blood in the body. Take into calculation, we can see if that elephant weighs around 3,000 kilograms, so this means we can collect 48 liters of the blood without any harmful to elephant. This is quite a lot, but then you have to realize that you spend a long time. Sometimes you have to spend 3 to 4 hours or 5 hours in collecting the blood, and then after that, that would be really harmful to elephant. So sometimes when we collect the blood something like 10 liters. That's more than enough, because you have to use the blood bag, human blood bag, and then after that you have to use a needle, and then go to one ear vein and again ear vein and again ear vein. So if you can have another alternative, like go to some part of the saphenous vein, that would be better. And then after that, when you want to collect, you use male or no plus female, because for the pregnant female, there could be some of the contamination, that means antibody produced between the fetus inside and also of the mother. So they can have something like a reaction to the recipient when you get the blood or plasma from this donor to the calves. Try to avoid that kind of reaction. It would be better to use the male or plus female, and also that one should be big enough to get the blood, also like a human. And also we should have a health and infectious disease screening, like that particular elephant for the donor, they should have a good health, and also we screen for some of the infectious disease like a herpes virus, brucellosis, or tuberculosis. Yeah, for that one. And also when you collect the blood, please collect the serum storage that put in the freezer, that for the future when you want to give this plasma to the recipient, to the calf, because you have to do the minor cross match to prevent something like a non-compatibility. And also when you want to give the plasma administration, you can give 0.5 to 2 milliliters per kilogram per day. That would be some recommendation. And there will be some of the fresh plasma transfusion. One of the advantage that this one, because in the fresh plasma, we talk about this already, in the fresh plasma that there is platelet that it can be used in giving to the elephant calves. But anyway, sometimes in the remote area, not in the zoo, for instance, like in Thailand, some elephant calves is in a remote area, really far away. So if you want to, and also for the donor, you have to collect the blood, and then after that, bring back to the lab, try to spin down and separate for the plasma, and then bring it back to the elephant calves. Sometimes it takes around 3 to 4 hours for this whole process. Sometimes it's too late, because from today, you know, the faster that you treat and give plasma to the elephant calves, the higher chance of survival of this elephant. So you should do it immediately as fast as possible. So this means the fresh frozen plasma would be the choice for in the remote area, especially in the elephant range country. So this means when you elephant suspect for the herpes virus, and then after that you just take the fresh frozen plasma from your refrigerator and thaw it and give it immediately. But then you have to do the cross match first to see any compatibility of the calf and the donor and the recipient or not. And also inside the fresh frozen plasma, the platelets is not function much because of during the freezing process, the platelet is activated and then lost some function. But still going on, they have some of the clotting factor, for instance, like a fibrinogen, factor 8, and other clotting factors, as well as albumin and immunoglobulin still inside. It would be useful, better than nothing, to give some protein or some of the fluid to the elephant calves. So that's come into my objective, that we want to compare the efficacy of Asian elephant plasma, fresh plasma after freezing. So we hypothesize that the efficacy of Asian elephant fresh frozen plasma, such as clotting factor and immunoglobulin G, are not different between before and after freezing. So in the material method, we collect the blood, and then after that we separate into small tube, and then after that, before we freeze, we send the plasma sample for checking of the fibrinogen using fibrinogen cloud assay, and for the factor 8 we use one storage clotting assay, and also we separate for the serum to check for immunoglobulin G. And then after that we have another samples, and then we store that one for the 4 months and 8 months and 12 months, and then after that, after we take that samples from the fridge, from the freezer, and then take it out to measure these factors. Also, we use 20 healthy elephants from Mesa and Matang Elephant Camp. So we have 10 males and 10 females. And then when we collect the blood, we collect it, put it in the CPDA or citrate phosphate dextrose and so for the anticoagulant, and then after that we spin it down to separate plasma, and then we divide into 4 aliquots, and also we use put them in the red cap tube for separate for the serum, because of the limitation of the laboratory, that if you want to check for immunoglobulin, it should be just really the serum in our lab. So that's why we separate for using both in plasma and then in the serum. For this one, in the month before freezing and 4, 8, 12, so we send them to check the clotting assay in the human laboratory at the human hospital. So using automated blood coagulation analyzers, and also compare to the standard curve. So we check both fibrinogen and also factor 8. And for the immunoglobulin G, we use serum and then send to Faculty of Veterinary Medicine, Chiang Mai University Diagnostic Laboratory to check for immunoglobulin by chemistry automated analyzer as well. And then for statistical analysis, we use t-test and repeated measurement ANOVA to compare male and female, and also fresh plasma before and after thawing, after freezing at 4, 8, and 12 months. So for the result, first we check there will be some energy sex different or not. After we see in fibrinogen factor 8 that there are no difference between sex. And also for the immunoglobulin G, there is no difference as well. So we take all into account to compare before and after freezing. If you see from here for the fibrinogen, you can see that it is not much different. You can see from here, and there is not significant difference between at the month 0 before and 4, 8, and 12 months. And also for the factor 8, it's like a decrease, but around 16% decrease from the beginning to this one. And also if we go to immunoglobulin G, we can see it significantly increased from this one, go to be higher. So for the discussion, we can see that fibrinogen level in plasma before and after storage, not much different during the freezing period. It's also the same with a human study. For the factor 8, the post-storage plasma decreased significantly with the same as the previous study in dog. And when we read in the literature and also discussing with the human laboratory, they also the same. For this one, factor 8, it also like a very fluctuate. In every paper, even though the human, they said about that the factor 8 also decreased or sometimes very, very variable. But if you see another one like a fibrinogen, for this one we use the correct assay, and also the result that is quite not different from the previous study. But for the factor 8, sometimes it could be post-storage for decrease, and also it can be something during the process as well, because it also in every laboratory. And also for the immunoglobulin G, we determine that the serum of the plasma, okay, we use serum instead of plasma because of the laboratory limitation, and also immunoglobulin concentration after the storage increase, it can be from the aggregation of the protein inside the tube. And also one thing to let you understand that because we put in a small tube, not like a big bag. So that means when we going to put in the freezer, it will become frozen faster than putting the whole bag. So the fresh frozen plasma storage duration is also the same. It can be used for 1 year. And thawing at the 37 degrees Celsius not affect for the result, and the smaller volume of that we storage put in the small tube, that it can also affect for the study. But anyway, when we take it into the conclusion, we can see that the efficacy of Asian elephant fresh frozen plasma stored at -20 degrees Celsius for 12 months slightly different from the fresh one. But the clotting parameters still acceptable because it decreased and changed less than 15%. It's acceptable and could be used in clinical treatment. And also if we store it from the other papers, other study, because we use in -20 degrees Celsius, because we can put in the normal freezer. But if you use like a much colder, for instance, like a -40, -80, you can store it up to 7 years from the literature. And from the further study, we can see that if we want to measure other coagulation factors, for instance, like a factor 2, factor 5, 7, 9, and 10, and also 1 Witterbrand factors, it would be more helpful for that one. And also for the storage temperature and duration, that could be longer. And also when we want to use in the field work, especially in the elephant range country, and environmental factor for storage and transportation. For instance, like sometimes would be fluctuation of the temperature that we can use with them. And also we want to use it for the plasma bank for sharing. For instance, like in Thailand, when we routinely collect this sample and put in the freezer, any case happen, we can send from the north to the south of Thailand for the emergency treatment. So I would like to thank for this organization that we see we work together. This is Faculty of Veterinary Medicine. This is Faculty of Associated Medical Science. And also this is Human Maharaj, Human Hospital and Smithsonian. And also Elephant Camp, Mesa, Metang. And also this is the Thai Elephant Alliance Association that several camps want to donate their elephant for donation of the blood to help other elephant camps. And also we create this logo for the EHV Task Force Thailand. We just have that one because we have like a 5 years meeting now. That is my end of my presentation. Thank you very much.